Good morning, you guys. It is time for your health check. And with vaccine distribution logistics, I know that there are a lot of questions out there. I wanted to take an opportunity to answer some of our most common ones. And joining me this morning is Dr. Mark Casanova. Thank you so much for your time today, Dr. Casanova. Our first question is from Lisa, who's asking, what is the realistic time frame for Group 1B to be vaccinated? This is a really common question. I know Lisa is asking for her 85-year-old mom.
Yeah, great question, Lisa. And I think the pragmatic answer is 1B with hundreds of thousands of individuals that fall into that category in North Texas is likely going to take as long as a month to 2 months to complete. When we looked at our H1N1 vaccine experience, the initiation of it was a bottleneck. So as supplies open up, as vaccines begin to flow more readily from manufacturing, we will see the pace pick up. But I do think we need to be prepared for up to a 2-month window, possibly.
Okay, so what I'm hearing is you got to be patient still and again. Our second question is from Douglas. This is a pretty easy yes or no answer. Is the vaccine free?
Yes, Douglas, it is. And that was a decision made by the federal government, realizing that we cannot afford health inequities to get in the way of vaccinating the masses and getting out of this COVID-19 pandemic via herd immunity.
Okay. Yeah, and access being a separate issue from that. But then our third question from L. Greenberg, can you ask about the release of current vaccines without assurances that the second doses will be available in 3 to 4 weeks? I think this is a good question because people want to make sure, of course, that they get both doses within the proper amount of time, which is, as far as we've heard, how it is most effective.
Right. And I'm reminded of the movie Jerry Maguire, Show Me the Money. In this case, it's Show Me the Vaccine. It is an ask of faith. We have to understand that. There's been nothing to suggest that the supply of vaccines have slowed. So therefore, it should be anticipated that the second vaccine supply chain should still be adequate. It's also really important to acknowledge that if an individual is 1 or 2 days out of that window of their second vaccine, it's not the end of the world. Immunity will still kick in. But what's probably the more important message is that we still need to be maintaining those pandemic commandments, and especially wearing a mask and avoiding congregate settings well after that second vaccine, and certainly in the window between the first and second vaccine. It is regrettably still possible to acquire COVID-19 infection in that window or shortly after the second vaccine.
And Dr. Casanova, are you encouraged by these mega vaccine centers that are set up that you see across North Texas?
Yes, I think it's an appropriate step forward. I think we need to realize that it increases the capability and ability for individuals to get the vaccine. Some will be able to get them through their physician's office, healthcare systems. Now we have these mass vaccination sites. We'll also have private pharmacies that, as their supply ramps up, so the ability to get the vaccine, we fully anticipate in the coming weeks, will become increasingly easier. So hats off to the leaders of the state and our county levels that have set up these mass vaccination sites.
And finally, I'm just wondering, we're coming into eventually warmer weather. We've got these mass vaccinations. We've got a population who eventually will build this immunity. Is this all do you share this optimism, basically? I think, are we trending in the right direction?
We will trend in the right direction, but, with this optimism and this light at the end of the tunnel, right now with the situation we're in, with seeing cases rise, we need to make sure that light at the end of the tunnel doesn't turn out to be a freight train barreling down on us. So is there room for optimism? Yes, and we need that. We emotionally, psychologically need it. But we equally need to be careful. We need to dampen down our efforts or clamp down on our efforts. I'm sorry.
Dr. Casanova, thank you so much for your time this morning. Really appreciate your insight as always.